is Matthew, and this is my NG2 skill video. I've gone ahead and introduced myself to my patient and confirmed his identity. I explained the procedure and he understood it, and I also let him know that if it becomes too uncomfortable at any moment, he can raise his hand and I will stop. We're in a private room right now, and I've also washed my hands and put on clean gloves. The first step is going to be assessing the client's nares. It looks like the right side is more patent. At this point, I'm going to prepare 3 pieces of tape. 2 of them are just going to be regular strips of tape. And then my last one will be torn down the middle until it looks kind of like a pair of pants. Okay. At this point, I am going to measure out how far I need to insert the NG tube, and I do this by measuring from the patient's nose, ear to the xiphoid process. Okay, and I'll mark this distance with one of my pieces of tape. Next, I'll give my patient some water or ice chips to drink, and this is going to help with advancing the tube. It helps to advance it as the patient is swallowing. And then I'll cover the patient's chest with a towel. And also give them an emesis basin in case they throw up. Okay. At this point, I'm ready to insert the tube. This NG tube has been pre-soaked in warm water, so it is flexible. You can also do this by keeping it coiled around your hand. I'll apply some lube to the tip. And I'll start with my patient with his neck hyperextended. As soon as the patient starts to gag, I will instruct him to bring his chin down to his chest, and then I'll advance it the rest of the way. And if at any point I can't advance the tube anymore, I'll look in the patient's mouth and make sure it's not getting coiled up or just coming out through his mouth. Okay, my patient has started to gag now, so I'm going to bring his neck down, bring his chin to his chest, and I'm going to instruct him to swallow, and I'm going to advance the tube as he swallows. Okay, I've made it up to my piece of tape. And now I'm going to secure it with my little pants looking piece of tape. I do this by wrapping each pant leg around, starting from the bottom of the tube. Okay, now that that is secured, I'm going to go ahead and check the placement. This is done by 4 different procedures. The first I'll do is I'm going to push some air down the tube, and I'm going to listen to the stomach region and listen for a swoosh. I'll do that by inserting 10 to 30 milliliters of air. swooshing noise. The next step I'm going to perform is I'm going to remove some of the stomach contents, some of the stomach fluid. I'm going to do about 5 to 10 mils, and I'm going to check the pH. I always want to make sure I kink this every time I remove it. Okay, I test that on a pH strip. It turns out good. The range is from 5 to 1. And then I'm going to return the remaining fluid back because it has important electrolytes. Okay, the two remaining tests are the bilirubin test and the x-ray. The x-ray is very important. It will confirm that it is in the stomach. And once that's been confirmed, I'm going to secure the tube to the patient's gown. And I do that using my last piece of tape. And I make a little flap over the tube. And secure it to the shoulder portion of the patient's gown. And I want to make sure not to actually poke through the tube. It's just going through the piece of tape. Okay, now that that's secured, at this point I will wash my hands, remove my gloves, and that is my NG2 video. Thank you.